IoT devices that we have, okay, they are currently, we are using a lot of things, we are using a lot of data, we are catering to every bit of thing that is there, and we are having outcomes of it before dealing to doctor. For example, if you want to check blood pressure, earlier used to go, doctor used to press that little thing and check on the hand and stuff. Now you can do the same thing with a click of a button, okay. Similarly, clinical judgment or diagnosis. Now, if you have seen Shark Tank as well, he mentions a glaucoma problem. Okay, this is the leading cause of blindness in the eye. So even Google and all are having extensive research about the eye clinic, about the eye images, and studying them in detail, and what kind of outcome that is there, which can be diagnosed beforehand itself. So it is technically competing with doctors itself. And now people might not trust the systems as well, but a day would come wherein, even we as such, we generally tend to, it is not, prescribed, but we tend to Google our symptoms. First thing, if we have anything, I'm sure in the COVID wave, every one of you have, like, if you have, then you symptom, what are the symptoms? What are the, when you have some kind of cold of your, so, and it gives you a judgment, okay, this might be the scenario. And why is this possible? Because the Google has like millions and millions of data of people, they know every bit of thing. They know what kind of patient has suffered with what kind of disease, what is the problem with everything, and how different solutions have been provided to itself. And that itself is the learning process. Some, like good doctors have, if you have seen, like, they have a quite keen sense of judgment, okay. If like there are 100 possible outcomes and there was just one case out of 10,000 cases, it's still that good doctor would remember, okay, this also might be a possibility which this man is suffering from. So that amount of knowledge that person has, and that is why you go to him, that amount of expertise he has. But similarly, the data power the Google has right now is immense. Then similarly, we go on to the like drug discovery aspect. We have to, so basically around like 5,000 drugs are proposed, toward the pharma industry, out of which five, make to human trial aspect. So as you can see, that's 0.1% of the total drugs that are developed, and out of which one is released into the market. Okay, so all this data, all this permutation combination that we are looking at into the pharma industry, into the healthcare industry, that has been driven by AI and ML itself. Okay, we have powerful clinical judgment and diagnostic tools. We have the data required. We have the patient history. We have the genetics as well. Okay, there is a lot of research going on genetic decoding and encoding as well. How, you know patients can be prescribed drugs according to his or her own habitat and well-being itself. Okay, that's that's very, in-depth analysis by the machine itself. Even we go to doctor, the doctor says, okay, where are you from, and doctor might slightly tweak the treatment if someone is from a different, habitat or living condition and stuff like that. So similarly, this can cater to in depth on a gene level itself.